Hey, Dr. Baker.
Hey.
Should someone get zirconia implants or titanium dental implants?
First, I think it's important that we understand what it is exactly that we're talking about. Fortunately, I have a model here. There's 3 different parts to an implant system. The first one is the implant itself, which is, you can see here below that clear plastic. The implant is the piece that goes in the jaw and it acts as an anchor. It's kind of a replacement for the tooth root. The second part is what's called an abutment. The abutment attaches to the implant and connects it to the teeth. And the third piece is the teeth themselves. We're really just talking about materials here, titanium and zirconia. So titanium is a metal, of course, and a lot of people have a little bit of reticence of having metal in their body and totally understand that. And the second is zirconia. Zirconia sounds like cubic zirconium, which is a fake diamond. And so that may sound like a familiar term. In our practices, we primarily are using zirconia for the teeth. It's beautiful material. You can get really thin with it and it's really, really strong. And it has so many amazing benefits. We also will use them for implants as well. Titanium is by far the most used material in the body. You think about every knee replacement that's ever been done, every hip replacement, all plates and screws and rods and back surgeries and everything, any trauma, broken bones, all of it, titanium. In the olden days, it was stainless steel and it's moved to titanium because titanium is really well accepted by the body. Now, there are some people that have real, true titanium allergies, and these are obviously not people that should have titanium in their body, and we test for those things. So the second one is zirconia. Well, zirconia is a really, like I mentioned, a beautiful material. It's amazing for teeth and can be amazing for implants as well. The advantage of zirconia is it is really kind to the tissues. So one of the big distinctions that should be made is everything I just mentioned, knee replacements, hip replacements, fractures, all of that is 100% below the skin. The difference in dentistry is what we do comes through the gums. And so both what is connected in the bone and in the mouth is it's all connected. And so there's this transition that we don't have anywhere else in the body when we talk about fractures and that kind of thing. And so this is why zirconia is a potentially really good option, because the tissues really love it. So the gums like to seal to that zirconia and make a tight bond so that bacteria can't get to that implant. Some of the downsides are that zirconia is a ceramic, like a ceramic plate. If you drop it on the ground, it will of course break, because ceramics can be brittle. In the case of an implant that's taking thousands of pounds of force, sometimes a zirconia implant could fracture. And of course we don't want our implants to fracture. That would be catastrophic. So that's a downside of zirconia. A second downside of zirconia is because of its brittle nature, you can't redirect the angle of the implant. And this is really important. Most of the patients that we see have very, very little bone. We tend to see the most extreme cases. And so if someone doesn't have very much bone, we need to put the implant wherever that bone is. And then we redirect the implant to allow for the teeth to be where they need to be. Now, you can't do that with zirconia implants. With zirconia implants, you get one direction because the forces need to be transferred just perfectly to that implant to make sure that it doesn't fracture. Now, there is a third type of implant, and this is my favorite. This third type of implant is actually an alloy. That means it's a combination. It's a combination of titanium and zirconia, both. They're actually able to make an alloy out of both of those materials so that you get both the tissue compatibility of the zirconia, but you also get the flexibility that we talked about with titanium. This is an amazing material. It's an amazing implant. It's what I prefer to use. In fact, it's what I use on most, if not all of my cases, unless somebody has a titanium allergy or really prefers to have zirconia implants that are entirely zirconia. So that hopefully that helps and helps elucidate the difference between a titanium implant and zirconia implant. There's lots to think about here, lots more that I didn't even share. The truth is you really need to see a doctor who has the understanding of these materials and some of the pros and some of the cons to be able to give you specific advice for your situation.